for a federal piece of legislation, we sure are talking about Obamacare quite a bit here in the state legislature. And I just want to kind of review a little bit of the short history. You know, we had a state-based exchange discussion a couple years back. That was defeated. We had a discussion on state partnership exchanges. We had 3 separate bills that were talking about state partnership exchanges to enable Obamacare. That was defeated. We had our recent Department of Community Health budget that came through, that we had the option of implementing Medicaid expansion in that budget. We didn't do so. It was defeated. So now we stand here before yet another attempt to go off and help implement Obamacare here in the state of Michigan. You know, I want to make sure everybody understands. I know this is talked about as Healthy Michigan, but the core of this is the expansion of Medicaid. And just for people's reference, the expansion of Medicaid is a key tenet of the Affordable Care Act. It's Section 2001 of H.R. 3590. It's a path to a single-payer system where nobody gets control over their health care. The government's going off and telling everybody what the prices are. They're telling everybody what they get coverage for. It's nothing short of government control of our health care decisions. And the sad part is the health care that they're providing, especially in context of Medicaid, is by many peer-reviewed measures not good quality care. Time after time, study after study has demonstrated that the care that's provided under Medicaid produces no better healthy outcomes than the care received by people without insurance at all. And now we're propagating this. We're putting that on steroids. We're spending a lot of money to get poor healthy outcomes. And bottom line, what we're proposing on doing with Medicaid expansion is that we're creating higher cost of health care for some, and actually for many, and we're using that higher cost and the taxes associated with that to subsidize the cost for a few. It's redistribution of wealth. And where that wealth is distributed, well, there's a case here to say that, well, we want to make sure we get our fair share. If we don't do it, we're going to be a donor state, and we're not going to get the money that the federal government is already collecting and spending, or in taxes. Well, there are quite a few taxes associated with Obamacare. I mean, that's one of the areas we don't have control over. We do have control over whether or not we expand Medicaid or not, but we don't have control over the fact that the federal government's taking these taxes. But the net result of these taxes is that we're being told that by spending $1.5 billion more of your tax dollars, which, by the way, we're borrowing. We don't have that money in the federal government. They're actually taking that money away from Medicare and using the Medicare savings of $716 billion in Medicare cuts to go off and pay for the expansion. They're using that money to pay for this expansion of $1.5 billion. I find that personally morally reprehensible. But anyway, we've got this $1.5 billion. And the bottom line is we're spending more money. Our budget next year for the state is going to be higher than it was the previous year when it comes to Medicaid spending. That, for me, is an increase in spending. That's not a savings, folks. I want to highlight, too, that that increase in spending and any savings that are denoted from that to the state disappear after 4 or 5 years. And that's just assuming that the assumptions, the actuarial assumptions associated with that actually hold true. Coming in year 5, we just started on this nice little downward trend there where we risk higher and higher debt levels for our kids. And that's who really suffers from this expansion bill right now. We're spending money we do not have. And we're racking up debts so that we're forcing decisions right now onto our youth because of the decisions we're making now for political convenience. And I got to tell you, folks, I find that disheartening. We should be respecting our youth. I also want to point out that hitching our wagon to this Obamacare train is a very high-risk venture. Can't tell you how many of these milestones have been slipping. First, we were supposed to have everything operational. All the employers were all supposed to be active as of this open enrollment period starting in October of this year. Well, now that's been postponed for a year. Now the only people stuck are about 20% of the population that this is intended to help, and that's the individuals, because they don't have a big lobbying group to lobby for them. That's we the people, folks. Odds are that's going to be delayed as well once they get into that credit card discussion that my good colleague from Midland talked about. I want to also highlight that when I'm starting to talk to employers, not starting, but I've been talking to employers for quite a while, and one of the biggest impediments to them hiring new employees or expanding their business or coming to Michigan to expand their business is healthcare costs. And as our healthcare costs are going up so that we can subsidize and provide free healthcare for a few, that discourages job growth. Employers in our state right now are moving employees from full-time occupation down to part-time. And the folks that are on part-time are having their hours cut from 40 hours to below 30 hours. More people are going to be put into this expansion population because of Obamacare. So every single time we say that we're covering the 400,000, I heard now it's 500,000 people. Well, when they've deployed this in other states, it's been 3 times the original estimate. And for us, that means 30% of our population is going to be on Medicaid. 70% are going to be paying for 30%. And it's hitching our train to a bill that has not been able to get out of the starting blocks. Matter of fact, they're even using a private exchange to help them implement this federal exchange. eHealthInsurance.com was put in place because they couldn't figure out how to convert their 20,000 pages of regulation for Obamacare into something that works. I've been in IT project management for quite a while, a lot of projects inside the healthcare industry. I'm telling you, I used to work on Space Station. We never had a 20,000-page spec on Space Station. There's no way they're going to implement this in the time frame that's been specified, and I don't know if they really intend to truly implement it. And yet we're hitching our wagon to something that has already is on, in the words of Democratic Senator Max Baucus and Harry Reid, is headed for a train wreck on its implementation. Yet we're proposing on hitching our ride on this train wreck. It's just unconscionable to me. And then we talk about uncompensated care, and we're trying to fix the uncompensated care problem. Just to put this in context, we had Ovik Roy from the Manhattan Institute Policy Research, expert at Forbes.com, talking about uncompensated care. You know how much of hospital business comes into uncompensated care? 0.67%. And yet, this is all a big deal here. This is what we're saying is driving the need for this is we got this uncompensated care. I don't know if you guys have seen lately, but if you're looking for construction cranes, you don't see them around businesses and manufacturing plants as much as you see them around hospitals. Gosh. And really what we're ending up doing here is we're converting this uncompensated care for undercompensated care, folks. This isn't fully compensated care. It's still 47 cents on the dollar. And this population sees the ER 3 times more frequently than uninsured or commercially insured population. Yet we're being told that this is going to cover going to take care of things for us. The last thing I want to talk about is that or second from last, is that this promotes this problem that we have with a third-party payment model that my bills actually attempt to correct. And part of the reason is we have escalating costs here in healthcare is that we don't even see what we're paying for when we go to the doctor. We don't see what we're paying for when we go to the hospital. There's very, very little price transparency. And in the industries in healthcare where we do have price transparency, things like plastic surgery, what's happening? Quality's going up, costs are going down. This is a bad deal, folks. And the last point I wanted to make was that ultimately what this, and in the words of my colleague here, this is promoting big government. Billions and billions and billions of dollars worth of big government are being promoted with the adoption of this bill. And that's billions and billions of dollars that are being taken away from you and I and all of our citizens and our constituents and being put into one sector. This is picking winners and losers, folks. So, in closing, when I campaigned for office, one of my planks was that I was pushing for effective healthcare systems. And I'm one of those rare breeds that actually read all 1,017 pages of H.R. 3200, which was the pre-kickback version of Obamacare, which is H.R. 3590. This is bad news, folks. When it comes down to it, this bill and all of those bills associated with hitching our ride to Obamacare is more about control than it's about care. And I want to recall the words of Congressman Dingell, one of the architects of Obamacare, when he talked about on WJR the rationale for delaying the implementation of Obamacare and what was the reason why we were going to wait 4 years before we kicked it off and start implementing this bill and the quote-unquote benefits of this bill. And he said that it would take that long to put in the necessary administrative procedures necessary to control the people. Well, I'm here to tell you, folks, it's supposed to be the other way around. The people are supposed to control government, not the other way around. And it's about time we started acting like that. I urge a very strong no vote to House Bill 4714.